Hi, everybody. Welcome. It's Angela Love-Zaranka with Lactation Education Resources.
And Sekeita Lewis-Johnson with Lactation Education Resources.
Thank you so much for joining us today. I just want to give a brief background on myself. I've been a lactation consultant, lactation support provider for over 30 years. I've worked in a hospital setting as well as in the community and in peer support organizations. Sekeita, how about you?
Yes, so I've been a maternal child nurse for over 20 years. I've also been a lactation consultant for over 10 years, actually almost 15, closer to. And I've worked also in the hospital setting as well as in the community setting. And so welcome and thank you for joining us today.
Yes, thanks for joining us. So just a little housekeeping to begin with here. We are recording this, and so you will be able to listen to the recording later. If you're asking questions and you're participating today from a desktop computer, the question box is here. You can see it's circled in blue and the blue arrow. So if you have any comments to make or if you have any questions, feel free to tap that box and you can ask whatever question you would like. Also, if you're on a mobile device, then take a look at the green arrow, and that points to where you can find the question box. There is no chat box in a GoToWebinar platform, but you can chat any comments that you would like to the organizers and to the panelists as well as to our support staff by simply making a comment in that area. Okay, great. So we also have somebody from our customer support team with us today. It's Julie Grimes, who also happens to be a board certified lactation consultant. She's monitoring the questions. She can answer some of them in the question box, which can be broadcast out to everyone if it's something that a lot of people are asking a question about. We also have Jill, who is our tech person on the call today. So if you're having any tech issues, feel free to type those into the questions box and we will make sure to address them and give you as much support as possible. If you're watching this recording on YouTube, you can post your questions in the comments below and or contact our amazing customer support team at support@lactationtraining.com. Okay, so let's dive in and take a closer look at what a lactation consultant is and how you can follow your passion and become one. If you decide to become an IBCLC, you will join more than 34,000 IBCLCs in 129 countries and territories. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiners. Take a look at their website, iblce.org. They have different regional offices depending on where in the world you reside or work. Review the requirements and the pathways to become eligible to take the IBLCE certification exam. Well, what do you need to know in order to take the test? There's something called a detailed content outline or exam blueprint, and it's based on a surveys of IBCLCs in various practice settings around the globe. They ask those IBCLCs, what do you do in your day-to-day life, and what are the topics that you're able to cover? So that information is in the detailed content outline, and the outline covers all of the topic areas and chronological stages an IBCLC needs to know in their work. The LER course covers the entire detailed content outline, and they are approved by LARC. LARC is the organization that approves and evaluates Lactation Consultant Training Program, and that acronym stands for the Lactation Education Accreditation and Approval Review Committee. So Sekeita is going to review a few questions to ask yourself today. Sekeita?
Yes, so before we begin, I think it's important to kind of ground ourselves in what are some of the things that are going to be covered today, but also more applicably, how does that relate to you? So it might be helpful to write these questions down, but keep at the forefront of your mind, do I have the skills necessary to become an IBCLC? And we're going to talk about those skills today, because when people hear the word skills, they automatically jump to the hands-on and all of those things. I'm talking about those skills, but I'm also talking about a heap of other skills. So do I have the skills? And if not, Where can I acquire the skills? That's the second part. So just be cognizant of these questions, and hopefully we're going to help you make sense of it. And don't worry, it doesn't have to make sense the first time around. You might need to hear this a few times, but just keep those in mind. And sometimes people need to hear this over and over again. So this will be recorded, as Angela said. So what makes an IBCLC? Talked about skills, but along with skills is competency. Competency is so critical. It's necessary to make sure that you provide adequate and appropriate lactation support. If not, that's when harm occurs. So competency means that you have the ability, the knowledge, and the skills to do it and do it successfully. So in a nutshell, we often talk about novice to expert, meaning if you're at the stage of just becoming an IBCLC, novice is I have the foundational knowledge and some skills, but I don't have the whole, I've been there, done that type of level of knowledge, so to speak, as say someone who's been in the field for over 10 to 15 years as an expert. So at the end of your training, what you want to be confident in is that you are competent, that you are doing no harm, because essentially that's what's important as we talk about competency. Culturally appropriate and credible. Let's first unpack what culturally appropriate means. If you've worked in healthcare, been around anyone in the business sector or in the work field, you might have heard the word culturally competent. And I just talked about what competency is, right? And so when I think of the word competent, I often think, can I as a person ever be competent in someone else's culture? And I tend to think not, so that's why I use the word appropriate, because we need to be clear as we're talking about language and how important language is, especially now. We really have this real awareness of how language can harm, how it can help. We want to make sure we're using terms that really make sense. So culturally appropriate is more fitting for where we want to be. And being culturally appropriate really starts with cultural humility, which is really defined as a lifelong process of self-reflection and self-critique, whereby I, as an individual, not only learn about other people's cultures, but I start with examining my own beliefs and cultural identity. And the definition that I just used can be found from the National Institute of Health. So that's one definition of cultural humility, but just understand it really is a lifelong process. And one of the things about cultural humility is that it really is the premise that we refrain from saying things or even believing or thinking things like it's not in their culture to do X, Y, and Z. You want to avoid those things because really we know that there are subcultures within cultures. And so it's very hard to just paint a brush of people as a certain set of ways of being and doing. So the first part of cultural humility is not really feeding into stereotypes, not making assumptions about what someone will do and won't do based on their culture, because we really don't know unless that particular person has told you in advance. So credibility, are you a credible resource? When you're asked a question and you don't know the answer, how do you respond? Do you answer off whim or like, okay, I had this experience, okay, this is my answer? And I'm asking this question because, when we think about breastfeeding and chest feeding, everyone wants to tell you their story. Everyone, their story. Oh, it didn't hurt me, or oh, it hurt so bad, right? So you can always reflect on your experience, because I believe that lived experience is important. But as a clinician, you want to rely on the evidence. So you want to use a combination. You don't just want to rely, because if you do that, you wouldn't be considered a real credible resource, right? Being a credible resource means you are giving out information that A, coincides with the best evidence, and B, you really know what you're talking about. So the question then becomes, do you know what the evidence says? And if you don't, do you know where to find it? We are not walking dictionaries or walking computers, or, well, some people have photogenic memories, but for the most part, it's important. It's not important that, and it's impossible. It's impossible to know every single thing all the time. But demonstrating credibility is about being forthcoming. It's about saying, I'm not quite sure. Let me check on that and get back to you. And then check your credible resources and get back to the client in a timely manner. Because if credibility is everything, and if you lose credibility as a lactation consultant or lactation supporter, it could translate into other IBCLCs or lactation supporters losing credibility. Policy advisor and creator, as well as advocacy. So a couple things that we do as IBCLCs is we do advise policy. We advise on policy. We actually help create policies. And that's important to know from the standpoint of talking about clinical care. Remember, I already asked, do you have the skills necessary? Well, what if policy work is your strong suit? I'm like, yep, okay, you have the skill set, right? We need you because, as I said before, language is important. Language and policies matter because a poorly written policy can end up with unintended negative consequences. So if you're a policy person and that's your thing, you already have a piece of what it is that we do. But also being a stakeholder is another form of policy work. IBCLCs are stakeholders, so that we should be at the table whenever lactation-specific or related policies are being discussed. So maybe policy is not your strong suit, but as an IBCLC, trust me, you want to know how policies are created and how they impact us, because then that informs your advocacy. Advocacy is a big part of what we do and who we are. An advocate is simply a person who publicly supports or recommends a particular cause or policy. So even if you're not a policy advisor, so to speak, you can be that person at the table listening to how policies are created and sharing your perspective and lived experience. Problem solver and researcher. Okay, so I keep saying everything is, all of these things are a big part of what we do, but being a problem solver is about 90% of what we do, because each family have their own concerns. And really, when lactation consultants are called for support, it is usually a request secondary to some type of problem or issue that the family is having with breastfeeding, chest feeding, or lactation. So be mindful about framing lactation concerns from a one-size-fits-all framework. Know that although we have all of this evidence to support a lot of the care that we deliver as lactation consultants, know that one size never fits all. And we really should be problem solving from using an individualized lens of what that particular family, what concerns they're sharing with you. So along with being the problem solver, remember I said you have to go back and sometimes you have to say, I don't know this, and look it up. Well, that's being a researcher. There are two ways to be a researcher. You can be a person who carries out academic or scientific research, or you can be the person whose job is just involves discovering or verifying information, and that is every single one of us. Let's remember, I said we're not walking around with everything up in our head. We have to have valid and reliable tools that inform our practice. High-level lactation care go hand in hand with skilled lactation care. When I say high-level lactation care, I'm going to kind of give you an example of what I mean. But what it is not It's not basic breastfeeding care, which I would consider non-complex care, care that's being delivered, such as care that's with latch and positioning. And sometimes that can be complex, but just I'm about to give you another example to talk about the spectrum of things that we do. So sometimes it could be just latch and positioning where the infant and the parent are both well, there's no other issues. I just need a little bit of assistance. That person just needs just a little bit, even sometimes some encouragement, right? Versus someone who is in an intensive care unit who was lactating prior to being admitted to the intensive care unit, who's also intubated with a breathing tube. Think about that case. It's so different from what I just said before. Are you able to deliver the type of care? Are you able to look at that person's medications and say, whoa, this person is on this medication, this person is intubated, this person may have a brain injury. How does that brain injury impact lactation? So I'm just connecting the dots on, are you able to make all of the connections in order to provide a clear, comprehensive picture of what it all entails for this person to have the best optimal lactation experience. So when you're doing your training and you're like, oh, this is so much, why do I need to know about the brain? You need to know about the brain because it is the level of care that sets the Ibclc apart. Being able to handle complex clinical cases with sound clinical decision-making and recommendations that are appropriate for higher acuity levels of care is skilled lactation care. So we talk about acuity, which is the level of care necessary for optimal outcomes. Do you have the skills necessary? Again, that question keeps coming up. I'm going to tell you right off, right now, I just gave you the worst case scenario, almost one of the worst case scenarios of someone being intubated. And that's not your everyday case, no. But the expectation is that you're not going into every clinical experience thinking, I've seen it all. Okay, they said this is what the problem is. Let me just go in here and work this magic. No, there's a skill set, and there's a skill set that you have to build upon. And in conjunction with saying, okay, I don't know everything, and evidence keeps evolving. So again, that skill also involves some professional growth and development along with it. All right. Essential and timely. One of the things that we found out during this pandemic is the word that essential is a buzzword. Essential. We found out that yes, lactation consultants are essential because babies still need to eat. People are still having children. And especially during a pandemic, promoting and protecting the ability to provide human milk is critically important. Not just from the bonding standpoint, but also from public health and prevention, from a public health and prevention standpoint. So yes, we are essential, and it's important that we show up when families need us, that we are timely, that we can't say no to folks. I mean, we can say no, but we're in a pandemic, so if someone is calling for our assistance, it means that they need help. And the thing about lactation is timely access is crucial to duration of infant feeding, breastfeeding, chest feeding, body feeding. So we're in this pandemic, and I know it's like, sometimes challenging, but we are frontline workers. And so I just want to make that really clear. We talk a lot about telehealth, we really do, but sometimes telehealth is not the end all to be all, and we can miss some things. Telehealth, prohibits the ability to use our other senses. And so it's extremely important to understand the practice of lactation, what some of the concerns are, particularly in a pandemic. But doing this work, I remember, and I can recall being called during the pandemic, right when the pandemic first started, where a baby hadn't been seen by the pediatrician, and the parent had been calling for support, couldn't get support. And when she did call for support, someone said, well, I can see you during a telehealth visit. And she said, I need in-home support. I mean, she was really like, it didn't matter that the pandemic had just started. She needed help. Well, it turns out that not only could the baby not effectively breastfeed, but the baby couldn't really effectively feed from the bottle. There were some tone issues going on. So as the advocate coming in, I'm like, okay, no, I need to become involved now. I need to let the pediatrician know I'm out here, and baby's not eating too well from a bottle. So think about the timeliness of that. We are essential, and it is really prudent and our duty to show up so that we minimize harm that's caused to families, that we are accessible, because that's what being an IBCLC is about, is being able to provide accessible care at the time that care is needed. Collaborative care partner, a trusted collaborative care partner. I love this phrase so much because what it assumes is that you're collaborating with your client. You are not the center of any decisions that are being made. You are simply there collaborating. Remember, it's the families and their partners, their goals, their fears, it's their barriers that takes precedence over your goals for them. So what am I saying? Well, I'm saying that we know the recommendations, exclusive breastfeeding for the first 6 months at least, right? We know those things. And it's important that we still honor those things and we still talk about them. However, we also have to understand that we are collaborating in partnership, in agreement, that when someone seeks out our care, that we make sure we approach it in a manner that we don't overstep boundaries that are not meant for us to overstep. And that's how you become trusted. In all honesty, you become trusted to do no harm, to be reliable, trusted to say, I see you as a person and we're in this together. I'm not higher than you. My IBCLC status doesn't give me superpowers to tell you what to do. That's not how you become trusted. It's simply collaborating to do what's best for the families as they are trusting you to assist them. So just be leery of going into clinical relationships or lactation support thinking, yep, I'm the expert. I know all about this. I've been teaching breastfeeding and chest feeding for 15, 20 years. I'm going to tell you how this should work. You're going to be fine. Don't worry about it. No, just be real easy and let the process unfold as a collaborator. All right, person-centered care. The Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that the patient values guide all clinical decisions. So I've talked a little bit about culture. I've talked a little bit about collaboration, talked about care, the type of care you deliver, and how communication works. And the person is the center of all of those topics. And if you want more information, you can visit the Institute of Medicine and you can read a little bit more about person-centered care, because person-centered care has also become a buzzword. Don't let it become a buzzword for you. Really practice what this model looks like, and then that would further build trust with you, not just with your client, but within the community that you serve, and also with other clinicians that work around you. So I started with 2 questions. I'm going to end this part with 2 questions. Angela's going to be speaking about the pathways. So when she's speaking about the pathways, some questions that you want to consider before you start this journey. You want to think about what pathway is most applicable to me. what does the market look like in my area for lactation consultants? Do I plan to work in a hospital setting, in a pediatric clinic, in an outpatient clinic? Do I plan to work private practice? What is that market like, depending on what your plans are once you become an IBCLC? And again, how does getting the hours that you need, the education that you need, how does that fit into your lifestyle? Meaning, how does it fit into your lifestyle with work, with your children, with your family, with all your other obligations that you have? Just put those things into perspective, maybe write them down to think about for later today. Maybe you can journal about it, but I hope that this gives you enough anticipatory guidance on how to think about the things that Angela is about to say. So take a deep breath and buckle up, because Angela's going to get to the meat and potatoes of our discussion today.
Thanks so much, Sekeita. Yes, so a lot of information for people. Now, I want to preface that I took a peek in the question box, and indeed there are some people who are asking questions. What if they're a doula, or what if they're a physician? You know, how do they become an IBCLC? And so these pathways that I'm about to discuss are universal regardless of the background. So I'm going to give you all the different components. And so we are going to address those questions at the end. So do keep the questions coming. So essentially, in order to become an IBCLC, it may seem complicated at first, but there's really a roadmap to do so. So the first thing you need to do is to choose a pathway. Now, we're going to come back to this in just a minute. Each one of these pathways has three components. There's the education piece, there are the clinical hours, and then there's getting ready for the exam. And so the first component is the health sciences education. It is the typical education for healthcare providers. So for the physician who asked the question, they've already got it covered. Nurse, they've got it covered as well. For those of you who are not already a healthcare provider, it requires 8 post-secondary or university level courses and 6 general education subjects. You can find a full list for each of these 14 subjects on the Ibclc website. You can search for it, or if you take a look at our resource document, which is a PDF, which is attached both to the live webinar and to the YouTube recording, you can actually find this resource actually on that page, which provides you with the list of the different courses that you need. So the 8 university level courses, and you don't need to write this down now, they include biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. These classes can be taken online or in person as long as the institution is accredited to provide the learning. If you took any of these courses during your college career, they count, even if you took those college courses 20 years ago. LER has 3 different university partners where you can go and get those basic courses. And thanks to some relationships that we have with those organizations, some will actually include a discount, and you can apply for financial aid with a couple of the universities as well. Now, the 6 general education subjects are medical documentation, medical terminology, occupational safety and security for healthcare professionals, professional ethics for health professionals, universal safety precautions and infection control, and basic life support. So now 5 of the 6 Gen Ed courses can be taken through LER. The only one you're going to need to search for is basic life support. In many countries, there is an in-person skills check for this training, but I've heard of some organizations providing this training completely online. It's important to check with your local resources. So in the resources, in that page, in the PDF that I mentioned before, there is a link to the Health Sciences Education Guide from the IBLCE website. The guide provides general descriptions for typical courses in the subject area. So please keep in mind that the IBLCE is an international organization. Therefore, the names used in that document to describe the courses may not exactly fit the description of the courses at your accredited educational institution. That's okay. IBCLC uses broad terms with the understanding that there is no universal description for what a course in, let's say, clinical research will cover. So why are these 14 courses required? The IBCLC is a standalone credential, meaning you don't need any other certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional. The courses will help you to be prepared for your career, as well as to help you pass the IBLCE exam. So the second thing you need is lactation-specific education. Well, this is where we've got you covered. The education should be comprehensive and cover the IBLCE detailed content outline. IBCLC requires at least 90 hours of lactation education and 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. So the third component is lactation-specific clinical experience. So this can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding and chest feeding families. It also includes lactation assistant to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. So how many hours do you need? Well, that depends on which pathway you choose. So the amount of clinical experience required to sit the exam does depend on which pathway. The hours needed to be accrued, as I said, in the 5 years prior to applying for the exam. So here's a quick overview. I'll review these in the following slides. So pathway 1 is intended for healthcare professionals and those who provide breastfeeding support through an IBLCE recognized breastfeeding support counselor organization. Now, healthcare professionals include physicians, nurses, midwives, dietitians, physical therapists or physiotherapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER, La Leche League International, the Australian Breastfeeding Association, the Breastfeeding Mother Support Group in Singapore, and many others. As of this presentation, there are over 40 organizations that have applied and are approved. And as of July of 2021, LER is now included as a breastfeeding support organization. You can find an updated list on the IBLCE website. Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 supervised hours working with breastfeeding families. So now pathway 3 is a structured mentorship program between an IBCLC and the applicant. The IBCLC, or if there's more than one, all of them need to be in good standing with IBLCE. So for students who choose this pathway, you must have your program pre-approved by IBLCE before beginning their clinical hours. Now, I do understand from our clinical director, our internship director, that this is usually happening within a couple of weeks. So now, just a quick note, for those of you who have breastfed or chest fed or provided human milk for your child, the hours you spent nursing and pumping and helping your friends don't count towards your clinical hours. Now, while 500 or 1,000 hours may seem like a lot, there is a really good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. If it's any consolation, the number of hours used to be a lot more. I've known IBCLCs who needed anywhere from 2,500 to 8,000 clinical hours before sitting the exam. So candidates who are applying for IBCLC exam through pathway 1, as I mentioned, need at least 1,000 clinical hours. For the candidate who's also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, our primary care practitioner's clinic or practice, or through an independent practice as a licensed or registered healthcare professional in a non-healthcare setting. So you may be asking yourself, well, who is a healthcare provider according to IBCLC? Do take a look at the link to the IBCLC website on the resource page. For breastfeeding support counselors from an IBCLC recognized organization, These hours can be earned online or in person. The location and type of support depends on the criteria provided by the recognized organization. As of January 1st of 2022, so this year, the hours need to be counted on an hour-by-hour basis. So 2 important points about clinical hours. One is that it's important to document those hours as you accrue them. Be very detailed in case IBLCE chooses to audit your application to take the exam. They may want to see that documentation, such as a spreadsheet or some other document where you actually counted your hours. And the second thing is the 1,000 hours do not need to be directly supervised. So now Pathway 3 requires 500 hours of clinical experience, and it must be directly supervised by a board-certified lactation consultant or Ibclc in good standing. This is best done in a busy practice setting where you can work with many breastfeeding, chest feeding, or parents providing milk for their babies every day, such as a hospital or clinic setting. So there, as I mentioned before, there is an application for this pathway, and you do need to have it approved before you can begin to accrue your hours. And those hours, the 500 hours, count only when you're actually working with families. Those observation hours that you spend don't actually count. And so, you know, clinical experience is something which is graduated. And that means that it starts out with observation, as Sekeita mentioned before, then it involves doing tasks under supervision, then completing those tasks in dependency with the Ibclc nearby to ask questions and discuss the clinical scenarios. And I recently had a conversation with our clinical internship director, Amy Black, and she agrees that most people are going to take about 75 hours in orientation before you and the Ibclc are comfortable with you having you work more independently with families in order to accrue the 500 hours. So take a look in your community and see if you can find a willing internship site or mentor. You may need to reach out to many people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through Pathway 3 to find successful strategies with finding a good mentor. Now, if you're interested in this pathway, do go to the Ibclc website and download that application. You will need your mentor's Ibclc number in order to submit the application. Now, LER, we do have an internship program with sites around the United States. If you are interested and would like to go through this, do reach out to us at support@lactationtraining.com and we'll connect you with our internship director, Amy. Now, a lot of people are asking whether or not they can accrue their clinical hours via telehealth during the pandemic. Now, the quick answer is yes. The longer answer is paraphrased from IBLCE documents. Those documents, there is one from the 17th of April 2020, the 6th of October 2020, and then also August of 2021. Essentially, Ibclc will allow the use of technology if certain parameters are met. You'll need to pay special attention to privacy rules and the Code of Professional Conduct for Ibclcs and clinical competencies. Another important point is that there should be observation using technology with two-way synchronous audio and visual components, and the focus is on the mentor providing the mentoring and the guidance to the applicant. So do read all of the IBLCE documents listed in the interim guidance. Again, a link to the guidance can be found in the resource document. At LER, there are two ways to gather your lactation-specific education. One is our Lactation Consultant Training Program, which is the full 95 hours, front to back. The other one is either the core course or the bridge course. They're designed to meet your educational needs depending on your background and previous lactation training. First, we have a comprehensive course called the Lactation Consultant Training Program. The LCTP is a 90+ hour course and it's eligible for CERPs, CME, nursing contact hours, and CEs from ACNM. It's intended for those who do not have any lactation education and they know they want to be an Ibclc. As mentioned before, it covers all the topics from the Ibclc detailed content outline. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices such as your phone, tablet, or your computer. They're optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we'll update sooner as new evidence emerges. If you have a question for the instructor or want to discuss a concept with your fellow students, there are several ways to connect and get the answers you need. We have a very active Facebook group for those who are in our 95-hour course, our core or bridge, or our exam review course, where students can meet and support each other along the way. There are people who are IBCLCs in the group who can also support your journey. Upon completion of the 95-hour course, you are eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you're a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have obtained. With this certification, you can begin to collect your clinical hours towards the IBLCE exam. The Lactation Consultant Training Program is that full 95 hours, but if you're not sure where you want to start, or if you have some lactation-specific education already, then we have our core or bridge programs to meet your needs. They have the same advantages as the LCTP course. Now, our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin to support the normal course of breastfeeding. It's 52 plus hours of online education. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is a Certified Breastfeeding Specialist exam. Now, the bridge course is ideal for people who have the basic lactation education components and they need the additional 45 hours to qualify for the IBLCE exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. If you're not sure where to start, I would suggest the core course. Get your feet wet and see if becoming an IBCLC fuels your passion. I'm very excited to announce that we have our 90-hour course as well as our core and bridge courses available in Spanish. Capacitación en Lactancia is our new website, which provides the same high-quality education found on LER, except in Spanish. Our team is here to help you now and in the future. We have tech support 7 days a week. You can get your questions answered by content experts in the field, and we have ongoing support for the next stages in your lactation career. For example, last week, someone reached out to me and they were looking for a question, or they were looking for the answer of a question from a scenario that showed up in their practice. We made the connection to the instructor, and the former student received the answer they needed to help their client. Another question had a student about creating a policy at their hospital, and we found the appropriate instructor to answer the question and provide additional resources. As I've mentioned, several members of our staff are also IBCLCs. They get it. They know what that journey is about, and they're here to support you. So thank you very much for your time today. So, Julie and Sekeita, what questions do we have? Oh, I know. I wanted to get first to the person who had a question about she's a doula or they're a doula, right? So, Sekeita, did you see that question? They are a doula and they want to start the journey.
I did see that question. I am trying to, undock the question pane here.
So I'll start real quick, and please, augment since you are a doula, Sekeita.
Yeah.
I would say that, really the way to start is you may want to try that core course. And the nice thing about the core course is that you will be a certified breastfeeding specialist, and you can then use LER, go through LER in order to obtain your clinical hours. So as a CBS, you can document your clinical hours under pathway 1. So that's going to be the 1,000 hours that you need. Those are unsupervised, but the nice thing is that since LER is now a breastfeeding support organization, you're not alone. You would have people like Sekeita and I and Nikisha Killings and Julie Grimes and others in order to answer the questions that you need. We are in the field. We are doing the work. And if you've got a question or a concern, please do bring it to us so that collectively we can help you to gather the resources that you need in order to support families. Anything else you'd like to add to that, Sekeita?
Yeah, thank you, Angela. So I would also add, so if you're a doula and you are already practicing as a doula and you have lactation related issues that fall outside of the scope right now, I would say whoever you refer to, or if there's a lactation consultant in your area, start building a relationship as well so that you can already start getting the wheels turned for mentorship. And not, when I say mentorship, I don't mean in a formal relationship where there's any exchange of anything other than just support and rah, rah, rah. Now, mentorship can mean a lot of things, but I would definitely say, yeah, start to do that. I did it backwards. I became a doula after a lactation consultant. But I'm a former labor and delivery nurse. And so, yeah, I think that it all like it can only make you marketable, more marketable. And really, I said, I said one size never fits all, right? But it's almost like one-stop shopping. You can provide doula support and
Yes.
lactation support on a clinically skilled level that you may not be able to provide as a doula, right? And so, yeah, I'd say go for it.
Absolutely. As a matter of fact, we even have a partnership with community-based organizations, and we're working with a lot of doula organizations right now where they are providing we have special pricing, very special pricing for these doula organizations, these community-based organizations to offer the certified breastfeeding specialist training and and they provide then that sort of like additional resources or additional education such as on topics of such as reproductive justice and what it means to serve the families in their specific community. It's a wonderful way to get more lactation support providers in the community, and that's why we have the special pricing. So we're very excited. We'll be announcing more information about that. And actually, we met with Tanae Lynn Harris in a previous webinar. If you go to our YouTube page, you can find that webinar from that Tanae gave, and we're asking and answering questions. And so it was a really powerful webinar. And so please do navigate to the YouTube page and check it out. There's another question here, a couple of questions about physicians and specifically a pediatrician. Also, there's someone who had so for someone, for example, who's a pediatrician, you can gather your clinical intern hours under Pathway 1 in your practice setting. I'm assuming if you're working, let's say, in, general peds, or something like that. But I'm assuming if you work in like pediatric oncology, then you may be limited in the number of dyads that you see who are continuing to breastfeed, and so that you may not be able to accrue hours that quickly. But if you're working in a general pediatric practice or some other sort of pediatric setting or some setting where you can use those hours, then indeed, remember it's self-documented, but do document your hours, and you need to accrue the 1,000 clinical hours in the 5 years preceding. So someone else who is actually working in the US now and is from another country has those hours from their previous experience working in their country. Ibclc is very clear that it needs to be in the 5 hours prior to actually sitting the exam. And so you will need to, gather those hours and find some way to provide that support to families currently.
So, Angela, there's a question about WIC during the pandemic, COVID pandemic. They've gone to mostly telephone visits. How does that impact counting the 1,000 clinical hours?
Me? So the short answer is yes, you can. You can do count those telephone hours. In other words, that is something which is Pathway 1. And providing that support, I actually started as a peer support counselor. And the first at least 10 years of my career, if not longer, it was providing mostly telephone support and running support groups. And so that is something which it definitely does count towards the time and towards your clinical hours. So although COVID has been challenging, your clinical hours will still count.
Yeah, along with that, I'm skipping a few just to talk about WIC associated, to stay within the theme. It says, I work with WIC as a breastfeeding peer counselor. Which would be the best route for me to take? as a peer counselor, if you're primarily working with families that are just strictly breastfeeding, that is your thing, I would say Pathway 1. Angela, what are your thoughts? And I'm only saying that because, some WIC, even though WIC is a national model, some WIC peer counselors operate in different ways, right? And so I want to be real specific on what I'm saying is that if the bulk of your hours you are providing that lactation support and standing in the gap for that peer counselor support, I would say Pathway 1.
No, I think that's wise. Now, granted, if you are, so WIC is the Women, Infants, and Children program in the United States. And through that program, you have to qualify. It's a certain percentage, I believe, of the poverty line in the United States. And so it is a federal government program that provides additional assistance and support for families who meet that criteria. And so, yes, I do believe that Pathway 1 probably is the best, but if you know of an Ibclc who's willing to mentor you and support you during your work, then that would be a way for you to gather your hours more quickly. And the nice thing about Pathway 3 is that because you're actively mentored by someone, people who take the exam under Pathway 3 and who've gotten their hours through Pathway 3, they usually score better on the exam. And the reason why, I think, is that active mentorship. And so if you do have that opportunity, by all means, do utilize it. And as Sekeita mentioned at the beginning of this webinar, find your resources. Even if you don't have someone who's going to be your formal mentor under Pathway 3, see if they're willing to have conversations with you, have a cup of coffee with them and say, and ask them if they're willing to support you and support you via text or some other way so that you can actually get that sort of like on the ground mentoring when it's actually needed.
Angela, there's another question that's asking if we have any programs that are connected with hospitals.
Oh, yes, we do. And so we do have programs all around the United States. We have affiliate agreements with many hospitals around the United States. That said, many of them are not accepting interns because of COVID. And so I think the best thing to do is to actually go to the hospital. You can reach out to us, you can reach out to Amy, our clinical internship director, and see if there is a site in your area. If not, then Amy is more than happy to give you some strategies by which to approach a local hospital that you may have a relationship with in order to start the conversation. And LER is an affiliated education organization, and so we can actually enter into an agreement with a hospital as long as they're willing to take you as a mentor. They may need some sort of documentation that you are with an affiliated education organization for that internship to go forward. And Amy is more than happy to coordinate and to sign those agreements and to negotiate appropriately. So yes, there is a cost for our internship program. And so do reach out to us at support@lactationtraining.com for more information.
Thanks, Angela. There's another question about when counting clinical hours for Pathway 1, the time spent with the dyad. So the question is essentially asking, is it the minutes that you specifically spend counseling about breastfeeding? So for example, if this person is working with a mom and baby for 30 minutes, but covering several topics, not necessarily all breastfeeding, how do you count that particular occurrence?
Well, it's really it's your best guess. In other words, you would actually calculate it yourself. And on the Ibclc website, they actually have a calculator. And so you can go in there and say, 30 minutes and 10% of that time was spent, actually discussing breastfeeding. Then there you go. Then those are the minutes that you're able to count. If you work on an L&D, labor and delivery unit, as either a nurse or a provider, how much of your time, estimate how much of your time is spent supporting those families and specifically on lactation. And so if it's 20%, 30%, many times when your colleagues learn that you're interested in becoming a lactation consultant, then doesn't it seem, Sekeita, that then you're the one who always gets tagged whenever there's a special, someone says, oh, bed 38 really would like some help with lactation. And so indeed, you're going to become that person. And so I would assume that the percentage of your time that is spent supporting lactation will probably increase once people know that you are that resource.
Yeah, I just want to add to this, Angela, about counting your time. Just really be intentional with making sure you are doing right by really with integrity of putting your time, because the hours that it take, I mean, you could, I'm not going to even say what I was about to say, but what I'm saying is it might be challenging to pass the exam if you do not get the clinical hours necessary. It might be fairly challenging because,
That's it.
the exam is practice oriented. Like there's detailed content outline. There are things that you should be able to apply to clinical situations. And if you've never had those clinical situations, and again, we're talking about novice level, but even still, you want to really adhere to the time spent, but also in the honor system of writing it down every time the time that you do calculate that you spend, that it is actually doing and providing that lactation support.
That's it. I mean, it's the journey, right? The journey is what makes us better lactation consultants. And, I've been doing this for a long time, but I learn something new every single day, almost with every family I serve. And so, walking into that space humble and knowing that the IBCLC is a professional. You are a healthcare professional with a specific scope of practice, clinical competencies, as well as a code of professional conduct. So even though it may seem tedious and frustrating because you just want to be a lactation consultant right away, do take your time and gather those hours.
There's
Speaking
a question.
Of time, yeah, were you going to answer the question about when to apply for the exam?
No, go ahead, please answer that question because I didn't see that question. So there you go.
Someone asked, do I really have to apply for the exam 6 months before I take it? And the answer is yes, you do. It's 4 to 6 months before you take the exam. For example, the application window for the IBLCE exam for September of 2022 is open now, and it will close, I don't want to say this wrong, but I think it closes sometime in mid-May. So it closes sometime in May, and then that's it. So you have to have gathered your educational hours and your clinical hours and your college courses before you apply for the exam. So you can't apply for the exam and say, okay, now I'm going to finish up everything. No. You have to do it beforehand. So be mindful of that timing. So go ahead, Sekeita, what did you see?
Yeah, there was a flagged question. And it's really talking about private practice. So I don't know if there's any other questions as it relates to becoming an IBCLC, but this one is stating that they're interested in breastfeeding, supporting breastfeeding families on a part-time basis as an IBCLC. Is there a minimum number of hours that is beneficial to making a private lactation practice worthwhile? So it depends on what you mean by worthwhile. It depends on the market. It depends on truly where you are. It depends on a lot of things, but geography is one of the biggest things that I think about, as well as what worthwhile is. What does that mean? Does that mean in financial terms, or does that mean in I get my feels? I don't know the answer to that, but I'm going to assume maybe financial. And I guess what I would say to that is you would probably have to do a market analysis where you are and to find out what are people billing for lactation services. Also, is the market there? Can people afford that amount? So I think there's a little bit of homework to do regarding whether it would be worthwhile for you working as a part-time IBCLC.
Right, and it also depends on whether or not you can If it is typical in your community to have people just simply pay directly to you, or if you need to negotiate with a third-party payer, such as a health insurance company in the United States, what does that look like? Do you need to be registered? If you're in another country, do you need to be registered as a lactation consultant? And what does that look like as well? So it really depends upon where in the world you live, as far as what the answer to that question is. So someone else is asking, sorry, it distracted me. Would I have to meet the hour requirement for either pathway and also the lactation and basic education, or does the pathway decide what education you need? So the pathway doesn't decide which education you need. The pathway decides how many hours you need. And so everybody needs those college courses. Everybody needs that 95 hours, and how many hours you need actually helping families one-on-one. That depends on if it's pathway 1, 1,000 hours working on your own, or pathway 3, 500 hours working under an Ibclc. That's the distillation of all of this. Hopefully that helps. Oh, someone's asking.
Okay. I didn't see any more questions, but that doesn't
I
mean
did. There's one
okay.
that made me chuckle. Depending on if you're a parent, how demanding is a career as an Ibclc combined with your role as a parent? Well, I think it depends on what kind of a parent you are and how many children you have, and what sort of your life looks like. And so, as Sekeita was mentioning in the beginning, we do need to offer that support when families need that help, and being available for when families do need that time. But of course, you do have time that you are a parent. And so I have juggled a very active private practice while raising 4 children. I have also worked in a hospital setting where, which went through baby friendly and baby friendly designation and redesignation. So, I know that there were times when it was challenging to juggle. It also depends on the ages of the children. And so all of those things need to be considered when you're trying to figure out how you can do this. Know that attaining your clinical hours and the lactation-specific education, that's going to take months, if not a year or two. And so then, you kind of can ask your question, well, what are things like a couple of years from now? What do I envision my life to be like a couple of years from now? If you have friends with older children, then that may give you a little bit of an indication. Sekeita, is there anything else you wanted to add?
Yeah, I was just gonna say, Angela, you hit a lot of the stuff on the head, but I wanted to add to it in like real life terms. Like I can honestly say I was working in the hospital as well as doing home visits, and my children were young. And when I say young, 5, 6, my 2 boys were. It was challenging to meet the needs of putting myself out there as a lactation consultant, also having a full-time job and being a student and all these other things, right? But now they're 14 and 16. And so they can stay here by themselves. Someone calls me and they really need me, I can just leave, right?
Right.
So that's the level of I think consciousness to bring to the table. The other thing is sometimes kids have school like baseball and this and that. How do you juggle all of that? And what does that look like? Does it look like, okay, I can do visits only on the weekend? Well, that's going to be a limitation to your clientele. But even if that's your availability, do you have other lactation consultants that can fill that gap that you work with? There's so many creative ways to make it work if that's what you really want to do. And so I would say, just think about it from the lens of all the things you need to consider as far as your family and your children and the ages, and what does it look like if someone calls you screaming and saying, I need you right now? Part of what we do is, I didn't mention the mental health piece, but as the pandemic has really hit us hard, a lot of us, it means being ready and accessible to your community, because sometimes we get those type of calls. What would you do? How would you handle that? So yeah.
Well, it's also about having your It's also about having your colleagues, right? In other words, when I was busy with something or I could tell that a parent really needed to be seen right away and I was either booked with other clients or I was working in the hospital or had to attend something for one of the kids, I would tap other people. And so creating that community of lactation support providers is vitally important as well, not only to support you with some of the complicated cases that you may not be familiar with, but also that you can pitch to whenever someone needs your help. And so indeed, that is something which, cultivating that group of professionals is very, very helpful. So there's a couple of other questions coming in here, and I'm going to make a caveat here. Somebody asked if you can open your own private practice as an IBCLC without needing a physician to lead it. In the United States, the answer is yes. However, that does depend upon your geopolitical region, and so do check in your country in order to determine whether or not that is possible. Someone else is asking a question about the difference between the scope of practice for an IBCLC and other lactation support providers, such as a CBS, a Certified Breastfeeding Specialist, or other equivalent certifications, and there is a big difference between the two. The CBS and other certifications, they usually will support the normal course of breastfeeding. Or there are some organizations that have specialized training, like let's say to support NICU families. So while supporting a NICU family may not be quote unquote the normal course, if you have additional training and if the training covers how to support those NICU families, then that is something which would be appropriate. But the IBCLC covers all of it. The IBCLC can help all lactation situations from the, depending on the acuity level that Sekeita referred to, everything from the simple to the complex. And so the more complicated the case is usually what is intended for the IBCLC. Did I miss anything on that one, Sekeita?
No, I just want to add something, and because this is just a personal thing, when I hear people compare IBCLC and CLC about when we're talking about scope of practice or when there's some questions, what I want to say is that everyone has a scope of practice. Nurses have a scope of practice. Dentists have a scope of practice. A dentist is a doctor who can't do cardiology surgery or cardiology consults, right? And so I just wanted to kind of put it out there that when you're thinking about the work, you think of it as the skill level within the scope. For instance, when I was practicing as a nurse and an IBCLC, in all honesty, I could pretty much see that it was mastitis, but I can't diagnose. I can't diagnose as an RN IBCLC. I would have to send the person to their provider. And so I think all of these things, scope of practice is just not a buzzword. It is applicable in everything that we do. Now that I'm a nurse practitioner, I can be almost one-stop shopping. I can say, okay, that's mastitis. Let me tell you what you need. However, what about if there's some marked asymmetry that it's like, whoa, what's going on here? Am I that person? No. Multidisciplinary care. That's what IBCLCs do. We rely on our scope of practice, and when things fall out of our scope of practice, then we refer out. And that would be the same thing that I believe a CLC would do, and a CBS would do, and all of the other acronyms that exist in lactation land.
Exactly. Good. Okay, one last question and then we'll go. So someone took a 54-hour course and they want to become an IBCLC and they are curious how can LER help them. And so yes, you do need the 95 hours. The 95 hours doesn't have to be from only one organization. It can be from multiple organizations. And so if you've already taken, for example, the CBS or some other training, then you can add to it our bridge course, which is sort of like that second 45 hours or the additional hours that you need in order to be able to sit the IBLCE exam. So we've got the bridge course. It would fit perfectly.
Yeah.
Okay, great. That was fun. Thank you.
Yes, today was like, yeah, I was on it today.
All kinds of great questions. This is fantastic. Thank you all so much. I really do appreciate your time. Thank you for joining us today. Thank you for watching the video, getting all the way here to the end. Hope you have a great rest of your day.
Yes, best wishes on your journey. Good luck.